compression, SI gap compression. And this one is sometimes done in a couple different ways. I'm going to have the patient lie on her back, supine, head up this end. And when you're thinking about gap or compression, we're thinking about the SI joint located posteriorly, but I'm going to be delivering force and introducing force into the pelvic girdle anteriorly. Okay? If we think about the SI joint and we remember about the SI joint, this joint is synovial joint anteriorly and syndesmotic joint posteriorly. So the most amount of motion in the SI joint occurs anteriorly. So I want you thinking about, as you're doing these pressures, how are we eliciting force through the anterior aspect of this joint? Okay, the anterior aspect. Easy way to remember it is a gap, and you're going to see some debate with how we name this as well, but this is, I believe, the more commonplace way of stating it. The gap is basically where I'm going to take the ASISEs and move them away from each other. The compression is where I'm going to take the ASISEs and move them toward each other. Okay? So if you're kind of getting confused, gap versus compression, think about it relative to the ASIS. Okay? The reason why we do that is, again, the anterior aspect of the SI joint is what's moving. So if we think about the gap, by moving those ASISEs away from each other, the anterior SI joint is going to be opening. Okay? So the gap looks like this. I'm onto the ASISEs on both sides. My arms are crossed. Slide a little bit closer toward me. My arms are crossed like this, and just real easy, I'm just eliciting force, and I just ask the patient, what are you feeling? I'm not trying to assess motion. I'm not identifying anything more than am I eliciting her symptoms. She says, oh yeah, that hurts, but it's not her pain. I write it down, produce pain, but it's not reproducible pain. It's not her pain, so it's not a positive test. I'm really looking for her pain. If it produces a pain, I'll write it down. But again, clinical significance, it's dropped down my list of priorities versus actually causing her pain. Okay, so I'm making a distinction between production of pain and reproduction of her pain. Okay, so here's the gap. I'm here like this. The compression with a person this size, easy to do. I'm just here like this, and I'm moving her ASISEs closer to one another. With a larger patient, for the compression, you may have the patient lay on their left side, use the table to help you, and now I'm here, and I'm just providing compression this way. So again, I'm bringing those, I'm approximating the ASISEs for compression. I'm gapping the ASISEs for gapping. Okay, that's the SI gap compression. Positive if it reproduces their pain.